Hey everybody, happy Wednesday. It is, what are we here? Wednesday, April 7th. Today we're faced with news that apparently the Ford government is going to institute even more restrictions on our way of lives. And we're also faced with the news that apparently over the last 24 hours, at least three school boards, Peel, Toronto, Wellington, um, or no, um, yeah, I think it's Wellington. They have all decided that they're going to shut down in-person learning in schools. And, I wanted to just have a discussion on that. It's really scary when you have medical officers of health who are not elected and they're making decisions that are broad and wide-ranging, affecting people's lives. If you don't know, medical officers of health are originally were given the authority to do what they are doing now because of the fact that it was intended so that if they had to shut down um, dirty bars or dirty restaurants, they could have the authority to do that without having to go through any large, long, drawn-out bureaucratic process. But as I say, they are unelected, and they're just civil servants. What's also concerning is the fact that it appears that most of the medical officers of health do not have very broad ranging expertise in the medical field. So, in other words, their specialties focus on um, things like communicable diseases, viruses, and things like that, but they don't have a broad understanding of all the different impacts of society of their actions. And what I specifically say with that is medical officers of health. Show me medical officers of health is qualified with understanding the long-term psychological impacts of the actions they invoke. That's very important to talk about when you're talking about school boards and shutting down school boards, because as anybody that's specialized in the field of psychological health for young kids knows, that shutting down the kids' opportunity for social development is very concerning for kids' development. Kids that are in their prime development years need socialization. They need things like sports. They need things like recess and stuff like that to be able to develop a healthy psychological balance in their genetic makeup. And the medical officers of health are not um, properly equipped with the experience and the um, training to understand these impacts, but yet they're given this unchallenged authority to make these decisions. What's also concerning is the actual facts. Um, People don't seem to understand, but there is 99% plus of our teacher society, teacher group, that has not ever had COVID. The same is with our students. 99% of the students in the school system have never had COVID. 99 plus. I think Doug Ford said yesterday that it was 99.8 and 99.9% students and teachers that have never had COVID. But what is happening is that, and again, studies show this. I've read these studies in the last 24 hours that what is actually happening when they do have a case of COVID in a school, then what they do is they track it back to a couple of days before, all the different people that student would have come in contact with. They call it a cohort, and everybody in that cohort then gets asked to self isolate for 7 days or 14 days or whatever the window is. And what they've done is they've studied all of these examples where there has been a cohort that went into isolation, and they're saying almost exclusively, never is there a case where other people in that cohort is also being, diagnosed with COVID as well. So, I mean, obviously they've done the research and they've looked into this even deeper to understand what is really going on. And, again, almost exclusively, what they're defining is that when a kid in school is diagnosed with COVID, they're finding out that it's typically in a neighborhood that has a high um, infection rate, and it's actually in the parental community. The high infection rate in the parental community is what's giving the kid COVID, and they're finding almost exclusively that the kid is not passing it on to anybody in the schools. Okay, so they've done the checking, they've done the, um, the contract tracing and all that stuff. They've actually done the science to figure out what's really going on, and then they've traced it back and realized that there is no problem in schools of community transmission in schools. Yet our medical officer of health, our unelected medical officers of health, have taken upon themselves to interpret that data to say that they need to shut schools down. There's no scientific response to this. But now you have these medical officers who are demanding they need to go back into shutdown, and we need to go back into all this other stuff and all these more draconian measures. And they are, they are demanding this of Doug Ford. Sadly, we have even a premier, Doug Ford, even in Toronto Mayor John Tory, we have leaders who are completely unwilling to question this data. Now, I'm not saying they should not listen to medical officers. What I am saying is they should get a broad, wide encompassing look at what actions are being requested, and they should get a broad, fully encompassing look at what the impacts are going to be and whether the cure is more dangerous than the symptoms. Right? So, in other words, they need to take a look at, okay, if we're going to do more lockdowns, how much harm is it going to do? What is the cost benefit analysis? And our government is not doing that right now. They are listening only to medical officers of health who are qualified in only one field of practice, and that is epidemiology. And if you listen to anybody in the mental health field, they'll tell you how damning the actions they're taking right now have been on kids, asking kids to not be able to see their friends for months at a time, asking kids to not be able to participate in sports, asking kids to mask, and asking kids to do all these different draconian things without giving any consideration to what the long-term psychological impact is going to be. Amounts to some of the most horrific child abuse I could ever imagine. And this is coming from the words of medical health people who are actually specialized in the field of mental health. And you can even apply this to adults. StatsCan did a study a couple of months ago where they studied, they actually surveyed people about their state of mental health. Now, they said prior to COVID, it was typical to get about 2% of the population to admit that they had suicidal thoughts from time to time. Recently, in this recent study 2 months ago, they said that that number had gone up to over 10%. So, in other words, 5 times the number of people under normal circumstances are now having suicidal thoughts. 5 times people. They also said that 70% of respondents said their mental health is in a deteriorating state compared to what it was pre-COVID. That was 2 months ago. And all of these people are saying that it is related to the fact that they are locked down in their homes and not be able to do anything. So if the Ford government does come up with another stay-at-home order, essentially the only way this can be interpreted is they're saying that they do not care about mental health. They do not care about what implications are going to happen as a result of mental health. Now, I am all for shutting down COVID, okay? But I am willing to make sacrifices based on the best broad-ranging suggestions on how we are going to save society. I do not want to listen to just one medical officer of health is only focused in one field of practice. And that's what the Ford government is doing right now. They need to take a broader, wide-ranging focus on what the entire cost-benefit analysis says about what the best actions are to take. Anybody with any logical approach to things can question the fact that we've been in lockdowns in various degrees for over 4 months now. Toronto has been in pretty virtually complete lockdown for over 4 months. If it's still not working right now, how can you continue to argue unquestioned that it's going to work in the next 28 days? But what they can also do is they can also take a look at some of the data, the contact tracing that's actually, you broad ranging and, and factual and logical. Now, this data I'm talking about is where they've taken a look at um, warehouses and food processing plants. This is where the disease is actually being distributed right now.